Lou Leon Guerrero, as well as our Segunda Magalohan Guahan, Lieutenant Governor Josh Tenorio.
Hafaday and good afternoon. Before I begin, I'd like to give Admiral Manoni a chance to update you on the movement of our COVID-free sailors from the Theodore Roosevelt to the designated hotels in Guam. Admiral?
Thank you, Governor, for having me again today. I'd like to provide the people of Guam and the CNMI an update on our efforts concerning the crew of the Theodore Roosevelt and the greater civilian military community. As I mentioned yesterday, the process for moving these COVID-19 negative sailors has begun, with the first group of approximately 180 sailors moving into lodging in Tumon yesterday evening. We are targeting being able to move another 300 to 400 sailors within the next 12 to 24 hours. This is all based on a flow rate from Naval Base Guam, verifying that the sailors have tested negative for COVID-19 and are asymptomatic, as well as maintaining the proper social distancing throughout the military-led transportation process. More than 1,000 TR sailors have been moved from the ship and are currently in controlled locations on Naval Base Guam. We expect this number to grow in the coming days as we seek to facilitate social distancing and continue the deep cleaning aboard the ship. The Navy announced today that 31% of the USS Theodore Roosevelt crew had been tested for COVID-19, with 114 cases so far. Our medical team reports that some of the sailors who have tested positive have developed or are recovering from mild symptoms, but to date there have been 0 hospitalizations. Finally, I want to reiterate that the TR sailors staying in lodging are required by lawful order to remain in quarantine in their assigned rooms for the duration of the mandatory 14-day quarantine period. Military leadership will be present throughout the lodging to ensure that sailors adhere to the quarantine protocols, and military representatives will conduct daily health evaluations for these sailors. When we move these sailors out in town, this is not a liberty port for them. Their mission is to stay healthy and mission ready. For the sailors who have been diagnosed with COVID-19, their mission is to get healthy. I also want to emphasize that although these sailors will have negative COVID-19 tests, we will continue to conduct daily health checks to make doubly sure that we're doing everything in our power to protect our military civilian team here on Guam, to not contribute to the spread of COVID-19, and to preserve the warfighting readiness of our force. Theodore Roosevelt Strike Group, Joint Region Marianas, and your Navy, which is at sea today, are extremely thankful for the continued support and the well wishes from the people of Guam in the fight against COVID-19. Thank you.
Thank you very much, Admiral. I'd like to now call Linda DeNorsi, and she will give us an update on our COVID-19 status. Linda?
Thank you, Governor. Yesterday, we conducted 44 tests. Of the 44 tests, 34 were negative, 5 were positive, 2 had to be redone, and 3 also inconclusive. As of March 12, 2020 to April 2nd, 2020, there's a total of 518 tests conducted, 436 were negative, 82 were positive. Of the 82 positive cases, 76 are local cases and 6 are from the U.S. Naval Hospital. Again, those 6 cases are performed by the Department of Defense Reference Lab in San Diego for the U.S. military. In regards to the regions, for our COVID positive patients, 32 are from the northern, 31 from central region of the island, 13 are from the southern, 2 are homeless, and 4 pending determination. Thus, there are 82 altogether. In regards to the age group, there are still to this date no COVID patients that are below 19 years of age. 6 are within the age group of 20 to 29 years of age. 30 to 39 years of age, there are 11. 40 to 49 years of age, 14. 50 to 59 years of age, 15. 60 to 69, 23, 70 to 79, 8, 80 to 89, 4, and those 90 years and above, 1. The gender, male 43, female 39. In regards to their medical status, currently 42 are stable, 23 are hospitalized, And again, of those hospitalized, 12 are inpatient care at the Guam Memorial Hospital, 3 are in the Guam Memorial Hospital ICU unit, 8 are at GMH SNU, and of those recovered, there are 14. 2 more have recovered as of yesterday, 3 have died, and that's a total of 82. In terms of where their location, in terms of isolation, 31 are currently in home isolation, 11 are in the isolation site with the government of Guam facility, 8 again are in ICU, 12 are inpatient care, 3 are in ICU, and as I mentioned earlier, 14 have recovered, 3 have died. As far as the travel history, there are 65 without any travel history. With those that have traveled, there are 17. 2 are from Dubai, 1 from Hawaii, 1 from Japan, 10 from the Philippines, 1 from Singapore, and 2 from the US mainland. In regards to the quarantine sites, we currently have 130 individuals, the travelers that are still under quarantine. For those that have completed their quarantine for 14 days and have been released, as of April 2nd, there are 124 patients. As of April 3rd, 24, thus a total of 148 travelers that have completed their quarantine. Thank you.
Thank you very much, Linda. Recently, I told each of you that members of my physician advisory group were updating our predictive model for COVID-19. I've asked Dr. Felix Cabrera to present that updated model to each of you. What you're about to hear will startle you, but government can't win the fight against COVID-19 by itself. To prove this model wrong, we need all of you to do your part. That means you need to know what these projections say, and then you need to act in the best interest of your families. Once Dr. Cabrera has finished, Dr. Mike Cruz will walk you through the steps we are taking to prepare for surge, which we never hope comes. Dr. Cabrera and Dr. Mike Cruz.
Thank you, Governor. Good afternoon. I'm joined by 2 members of my surgeon cell team, Dr. Felix Cabrera, Dr. Louis Cruz, and Dr. Juan DeWin, who is the president of the Guam Medical Association and also the head of our healthcare advisory group. And we want to be able to present an update on our COVID-19 response and the planning efforts. So let me bring up Dr. Cabrera, and then we'll be followed by Dr. Cruz and Dr. Nguyen.
Thank you, Colonel Cruz. Afade Guam. Again, my name is Dr. Felix Cabrera, and I'm a representative of the Governor and State Surgeon's Physician Advisory Group. I'm here to present the Guam's COVID-19 extended trajectory for purposes of interventions, efforts, and readiness benchmarks. So the bottom line up front, our initial attack was suppressed, but the long war ahead. The trajectories presented from early last week focus on total COVID-19 positive cases to help predict the immediate threat to Guam's civilian hospital system collapsing. Early interventions by GovGuam, the medical community, and our society as a whole have successfully thwarted said initial threat. However, new and more sophisticated models looking primarily at the trend of hospitalized COVID-19 positive patients have provided us first full scale view of what could be Guam's war on COVID-19 over the next several weeks and months. Without implementing and enforcing much more strict compliance with the governor's social distancing and stay-home orders, the models clearly show Guam suffering through the greatest casualties since World War II. So a recap of major dates so far. So prior to the first known COVID positive case on Guam, the general public was very much aware, and the education process began regarding COVID-19 threat and the precautions needed. On Sunday, March 15, 2023, GMH patients became the first positive test reported on Guam. The following day, there was an order of school and non-essential government of Guam closures. On Thursday, March 19, first major travel restrictions with the first quarantine flight. By Friday, March 20, 2020 at noon, Executive Order 2020-05 was enacted with non-essential service closures and stay-at-home orders, Part 1, Version 1. On Sunday, March 22nd, unfortunately, we had our first COVID-19 related death. The following day, we presented our first trajectory of models that were published. And the day after that was Executive Order 2020-06 with the more strict stay-at-home orders and the closure of parks and beaches. So the 4 major government acts that affect COVID-19 spread, and this is throughout the world, is number 1, the school closures, and we already mentioned that occurred on March 16. Number 2 is the major travel restrictions. Number 3 is the closing of non-essential services. And number 4 is stay-at-home orders. And again, there are 2 different efforts in this manner, but enforcement in it has been a different part of what we've been enacting. So this slide here is a summary slide that pretty much shows what our trajectory has been telling us. This model is a model that was developed using classic epidemiological equations that looks at patients that are susceptible, who've been exposed, who are infected, and who recover. And with that, it's a process of taking the population that it's affected, especially here on Guam with its uniqueness, and also the limited resources that we have here on Guam in terms of our medical infrastructure. Here you'll see in the black curve, well, let me say first on the y-axis here is the COVID-19 cases, and then on the x-axis is time. Here you see in the dotted black curve is what the course would have been if we had done nothing at all from the start. And what you see here is that the hospital beds needed at the peak would have been 16,000 in one day. And the total deaths after 5 months would have amounted to 20,000 deaths. Here on the red, after the efforts that I had previously mentioned, we are currently on this trajectory as our worst case scenario. What it shows here is that we've decreased the spread by about 20%. And by doing so, we've decreased the need of hospital beds at the peak to 6,000. The total deaths after 5 months is being predicted by the model of being 3,000 deaths. If we work harder and we do more now, we could potentially get it down to 40% decrease in spread. And in that case, the model will tell us that we need at our peak 3,000 hospital beds and have 2,000 fatalities. If we do even better at 50% decreased spread, we could see a peak hospital bed need of 1,000 and total deaths after 5 months of about 700. And as you can see in the process, you literally can watch the flattening of the curve with our efforts. So of course, the main question is how do we get down here and how do we push this further down? And so that's where the last part of the 4 main intervention efforts, school closures and stay-at-home orders and non-essential business closures and travel restrictions. The one thing that we still have a lot more to do is the stay-at-home orders that have to be enacted and be taken very, very seriously by the people of Guam. So this here is basically another rendition of what the trajectory will look like for hospitalized census as of today. And so what you see here is on this day here, and this model, the day numbers here are just for the purposes of the model. But in this case, we will be right here. This red line represents the current COVID-19 hospital capacity. And as you can see, this is the amount of days that we have until this model says that we will reach that. And that pales into comparison to what the top peak here, which is 6,000, over 6,000 beds. And this equates to day 108 on this model, which will be about the first week of June. So in a way, you can see that you can visually see the tsunami that could potentially be heading our way. In a more close-up manner in terms of the following days, you can see that we have plotted out here the positive COVID positive census that are admitted at Guam Memorial Hospital in the skilled nursing unit, and how that plots out and how it relates to the current trajectory. The main purpose of this slide here is to actually look at what we need to do for planning purposes and benchmarking. So based on the 50th patient, the 75th, 100, 200, and then of course past capacity. And our purpose in this for this model is for readiness and planning, and to know when we need to hit certain benchmarks. And so with that, I'll go ahead and hand over the presentation to Major Luis Cruz, who's a family physician, and he'll go over our current plans for readiness and preparation for this potential surge. Thank you.
Thank you, Governor. Thank you, Colonel Cruz. In preparation for the potential surge of patients, we have been working closely with the Health and Human Services, FEMA, the United States Army Corps of Engineers, and the Governor to identify alternate care sites. We have a plan in place to meet the peak demand in hospital beds if necessary. Each phase will increase our bed capacity incrementally. Ongoing at this time, we are decompressing GMH, moving stable, vulnerable, non-COVID patients to GRMC and other sites, all the while ensuring high quality care. The Governor has mobilized guard assets to be placed at the GMH parking lot, along with federal assets that have just arrived on island. In addition, we are utilizing the Surgery Center for additional beds. All options are on the table, and we are urgently assessing each one in order to care for our people. Additionally, we are in active discussions to obtain PPEs, staff, equipment, oxygen, more beds from the federal government and regionally.
Thank you so much. Thank you, Governor. Thank you, Admiral, for everything. On behalf of the Guam Medical Association and the medical community, I'd like to pass the same message. Our island is at war, and this war we have is we deal with a very dangerous enemy, and the enemy is invisible. So we need everyone on island to help us fight this enemy. And the frontliner is not the medical community nor the hospital, but the frontliner is you. Every one of you need to help us fight to protect your home, protect our island. And the fight is very simple. And the message to all of you is please, stay at home, abide by the order of our governor to be sheltered in place. And if you have to go outside, you need to wear a mask. If you don't have a mask, any type of bandana to cover your face will be fine. And also wash your hand, and try to go out as little as possible to do the necessary things, but the shelter in place will really help us flatten this curve. The medical community and the hospital as the last line defender for you. So please help us by fighting this enemy, and again, shelter in place, mask in public, and wash your hand. Thank you very much.
I know that many of you might be frightened by what you have heard today, but that fear must give way to action. Each of us has the power to save lives and make this model wrong. We have two choices. We can act now and flatten the curve, or these predictions will become our reality. What we have seen in Italy, in Spain, and in the United States can happen to us. Overstretched hospitals will become overwhelmed. Basic protective equipment will run out. Beds will follow, as well as ventilators that provide oxygen to patients whose lungs are being attacked by the virus. Most concerning is the possibility that our healthcare workers will be affected. If we can't protect them and keep them healthy, the rest of the response will crumble. This could be our future, or it could be the nightmare we avoided because we had the courage to do what is hard. COVID-19 does not discriminate. It will infect the rich, the poor, the young, the old, men and women. It can infect your neighbors, your coworkers, your family members, and you. COVID-19 is a slow and long illness. People who were infected several days ago will only start showing symptoms now, even if they isolated themselves in the meantime. Most will suffer only mild cold-like symptoms, and about 80% of people with COVID-19 recover without hospitalization. But there will be some who will need acute care. And as that number rises, our healthcare system runs the risk of collapse. For this reason, I will be announcing further escalations of current measures soon. These actions will include greater control of our roadways and tighter social distancing requirements. Access to public roadways will be limited to movement for the purposes of traveling to and from essential activities, which I have authorized under Executive Order number 2020-05. While we are working out the details, vehicles on Guam's roadways will be required to display signs showing the essential function that necessitates their presence on the road. Furthermore, social gathering of any type, whether public or private, will be prohibited. To break the chain of transmission, your social interactions must be limited to those you are currently isolated with. These measures will be serious because we face serious consequences, but we have the power to keep ourselves safe, and we must use that power now. As we continue to enforce the social isolation directive and people are limited to their homes, it can feel like we are in this alone. We may be tempted to think that we must only worry about ourselves and not others. That is a very dangerous mistake. We must remember that we are in this together. Now is the time for solidarity. To win the battle, we must fight with love and compassion for those most vulnerable. Today's COVID hero is the Kadu Cares program. Kadu Restaurant has partnered with Catholic Social Services, Manietlu, and Grab and Grub to feed the chronically homeless Manamku living alone and families and kids who need extra help. Thank you, Kadu Cares, for reminding us that though we must be physically distant, we are not alone. This is uncharted territory for us all. Mistakes will be made, but even a perfect response won't end this pandemic. If we work together, if we keep on this path, we will beat this disease. Though these challenges may seem insurmountable, we will overcome just as we always have. Please stay home. Do you have any questions now?
Nick Delgado from the Guam Daily Post.
Nick.
Governor. Can you hear me, Governor?
Yes.
Okay, so you were right. The community already got their hands on a lot of these graphs that were presented today and were concerned. So thank you so much for having your physicians advisory group explain that to us. But does this prove that if we do follow these effective measures to stay at home, personal hygiene and the like, that there's still time to completely flatten the curve and remove this virus from our community, or is it just delaying the inevitable of what we're already seeing?
I really strongly believe, and in just looking at other places like China also, and Japan and Korea, where they were very aggressively putting these measures in place, that we must flatten the curve. And I'm hoping that where Dr. Cabrera was seeing the uptake of the trajectory, that we continue more in the low end of the trajectory. So I know it's an alarming situation, and what we need to do in an alarming situation is to really step up and win this. And it cannot be if we continue to see people traveling out there, if we continue seeing people doing social gatherings. I cannot express the criticalness of this, Nick. Our goal, of course, everybody is working to flatten the curve. But these numbers are being used to also prepare for the worst, because we still need to deal with the worst. And I don't know if Dr. Cabrera wants to add any more to that, but our goal is to flatten the curve. And I think we can do it. You see Japan, South Korea, and other countries have done it. So do you want to add anything, Dr. Cabrera?
Nick. I think the governor mainly hit all the main points there, is that, that this trajectory is not our fate, and it cannot be our fate. And all it is a model, and it's like a weather forecast, but it can be wrong. But we actually have the opportunity, not like the weather, we actually have an opportunity to do what we can to make it wrong. And so that's what I implore for everybody to do and to be a part of. And Guam has to come together to do this for each other. The key part here is that if this is a cultural shift that we need, and without that, we are not going to beat this. In terms of what other countries have been done to be successful, we just don't have those resources here. But what we do have is the heart to do it. And I really believe that we can do that here as a community, because we can come together and do extraordinary things. And that means holding each other responsible and accountable, and that we ensure that we do things to protect each other, and we not be selfish about what we want to do, but more think about what we need to do for others, people that we don't even know. And so everyone knows about staying home, and that's been preached, washing your hands, social distancing, but knowing it and practicing it is a completely different thing. And that we hope that these numbers give you a really good understanding of the scale of this invisible enemy. And so, this is what we really hope that the public takes home and understands, and that we continue to spread this message and the enforcement of it. Thank you.
Definitely some difficult times that us and the rest of the world facing.
I just want to add a thing also. If you look at Dr. Cabrera's numbers, if we hadn't done anything, if we had not done anything, we would have been in a worse situation. But the fact that we became very aggressive about our measures, we were very proactive with our measures, that's what's keeping us low down in our cases. So if there's already signs that it is working, we just have to work even harder to make it so that it continues in the lower part of the graph.
Yeah, definitely increase that percentage and the amount of cases, I'm sure, by more than 50, if not 100%. Thank you, Governor. And so my second question is, you mentioned a couple of the measures that you're going to put in place, greater control on the roadways and social distancing. Do you have a timeline of when that will go into effect? And I know—
Oh, sorry. Yeah, we're looking at making it effective on Tuesday. So we're working out the details, because we want to make sure that once we implement it, that it's implemented correctly, and so that it then becomes stronger, enforceable. So
it'll be midnight at Tuesday?
Tuesday?
At midnight, you said? Or
Oh,
would it be
no, Tuesday, probably in the morning.
We'll give details tomorrow.
We'll give details more tomorrow.
Okay, and so the second part of that question, Governor, you said that they would have to display a sign on their vehicles to describe their purpose. of their essentials. So what would that look like just for the average person out there in the community? Will I have to write or print on a piece of paper what I'm doing? I'm going to the grocery store. I'm going to pick up my meds.
Yeah, you know, some of the idea there is like if you put a letter A, right, and display it, that would be, oh, I'm going to the grocery store. Or if you put a letter B, that would say, oh, I'm going to the pharmacy. You know, so we are also looking at doing checkpoints just to make sure that people are really going to where they said they were going to go.
Sounds kind of like a lockdown.
Okay, any other questions?
Thank you, Nick. Next, we have the Mariana's Business Journal. Wayne Chargo.
Half a day, Governor. I actually have a question for Dr. Cabrera.
Sure, Dr. Cabrera.
Yes, Lou.
Hi, Dr. Guerrero. My question is, do you have any concerns about underreporting or any other factors that might affect the reliability of the numbers that your task force is using for your projections? If so, why or why not?
That's an excellent question, and it's a question that we asked ourselves actually very early on. So from our initial projections that we had, we were actually using the number of positive cases that we were seeing. After we had restricted the use and of our limited test capacity to the very high risk, that number no longer became a reliable representation of what the community's potential infection rate was. But one thing that we know for sure is if you're admitted at GMH or the skilled nursing unit and you have COVID, that was a very reliable data point. So that's what we use to start tracking our trajectory. And in the end, that's what really matters to us right now in terms of our planning stages. And that we're looking at our bed capacity, so let's track our beds. And so it was pretty straightforward in that sense, and it matched up with this SEIR model in terms of that where we can actually plan out a plausible worst case scenario trajectory that we could potentially be on right now.
All right, okay, thank you. That's my question.
No further question, Wayne?
No further questions at this time. Thank you.
KUAM, Nestor Loconzo.
Yeah, can I take Wayne's question? Since can I ask that we just?
Gosh, Nestor, I can't believe you.
Can I just ask that we just waive the one round for today, because we've got a lot of questions, I imagine.
All right, I as governor waive the one round.
Thank you very much, Governor. First question is, so when you talk about the implementation of this on Tuesday, it doesn't mean that people will not be allowed to leave their homes. Is that correct?
They are allowed to leave their homes if they are going to the grocery store. You know, it's following what our executive order has been, and I can't remember which number that is. But when we first said that you have to stay home, businesses are to close except for pharmacy, groceries, medical clinics. So you are allowed to travel on the road to go to those places.
Okay, but there will be, as you said, checkpoints and
Yes.
And so what will they be checking?
They'll be finding out what your business is on the road, and that's why we're trying to figure out how that would best be clear to the individual, to either the National Guard or the police officer that would be doing the checkpoint. And as I said, we haven't totally done all the details. Once we do, we will also be announcing it again probably tomorrow.
So what will be the instructions to law enforcement? They will ask you what you're going to do, and then what would be the sanctions if, for example?
You know, we've talked a lot about what would be the consequences. We haven't really decided on any. We're talking to our law enforcement people. We're talking to the National Guard. So I don't want to say anything right now till we get a very clear, definitive direction on that.
Okay,
and there will be checkpoints.
Okay, and those will be manned by the National Guard,
Yes,
the
absolutely.
police? Okay. Dr. Cabrera spoke of, and it looked like based on his chart, we're going to hit max capacity of our medical facilities by April 22nd. Is that correct, Dr. Cabrera? At the current rate?
Yes. What we have here on the graph, and I can just pop it back up here in a second here. So what you see here, what we have here, yes, and on April 22nd, we're looking at potentially, and this is theoretical capacity at both GMH and SMU of about 250 beds. And so this year will be with the assumption that we would be able to completely evacuate all non-COVIDs from both facilities to GRMC, and then be able to take as many as 250 COVID positive patients. And again, these are planning benchmarks. For example, if we once we hit these certain patient marks, then we would enact different rollout plans. And so again, we're only here on Friday, April 3rd. That's a long way from now, and there's a lot that can be done. And I think if we push the 200 bed day out way past here, then I think that's a tremendous accomplishment. We push the 100-day bed out, 100 patient bed day marker further out, then also that's another great accomplishment. So this can be our scoreboard, so to speak, and this can be Guam's scoreboard. And as we see this number getting pushed out here, then we know that our efforts are working. What it cannot be is a reason to let up, because there's a major delay in our efforts right now and what we're going to see further down the road. So I think if this goes down, it's because of our initial efforts from even a few weeks ago. And so I think that that's encouraging, but again, it's still far enough from enough, because as you can see, the scale is just tremendous here. But you know, again, this can be a much different trajectory based on what we do.
Thank you, Nestor. Pacific News Center, Kevin Kerrigan.
Good afternoon, Governor, and good afternoon, Dr. Cabrera.
Good afternoon, Kevin.
I'd like to ask Dr. Cabrera for some clarity with reference to the death toll. Explain to us what is the projected death toll under the current restrictions after 5 months, and what would the death toll be after 5 months once these new restrictions take effect?
So sorry, I should just leave this up and we can chat more about this. So this is probably the best chart to talk about the death toll here. So what you're seeing here, so on the left side, I just want to explain where these numbers came from. So again, this is if we did absolutely nothing, and if you're looking at where the disease having what's called an R naught, if we assumed it was at a 2.6. At 2.6, essentially everybody on Guam will get the disease over a period of time, maybe over about a 3 to 5 month period. And in that case, and this fatality rate was actually taken from what we're seeing in Italy right now, where the fatality rate of those who get the infection of being about over 11%. The rest of this here is actually a conservative estimate where we're using a mortality rate of about 2% in these other cases here. And so what the 3,000 fatality prediction here is based on 2%. The harsh reality is that if this surge truly happens, and with our inability to keep up, that number is going to change drastically, as we're seeing in Italy and New York City as well. And again, that's something that we're trying our best to avoid completely. But so it's not necessarily just hoping for the best and preparing for the worst. We're working for the best and working for in preparation for the worst.
Okay, again, it's not clear. I mean, how many deaths will there be after 5 months? Number of deaths under the current restrictions. How many deaths are projected after 5 months with the new restrictions?
Oh, I'm sorry, I missed that part. So I think that's an extremely tough question to answer. And the reality is that with this here, the further out we go out in the model, the less confidence we have in the numbers overall. But it gives us a gives us an idea, gives us something to go with here. But I think if the restrictions are done in a very responsible manner that everybody takes very seriously, we have seen in other countries where with these extra enactments that we could definitely be seeing at the 40% mark to maybe even closer to the 50%. But we'll just have to see. And again, we'll update these models as we go along.
And who will enforce the current travel restrictions, Governor? Will it be Guam Police, Guam Guard, and members of the military? Will there be any fines for violators?
So, Kevin, first, of course, our Guam Police Department will enforce the travel restrictions on the roadways. And I have asked the Guam Police Department and also the General to come up with a plan, and they'll be presenting the plan to me on Sundays. So this is something that's evolving, and we haven't, like I said, really ironed out all the details. Until we iron out all the details, I will give you more information and update you.
Thank you, Governor.
Thanks, Kevin.
No more questions, Kevin?
Yeah, I do have another question for the governor, and that is, as she well knows, there's some in the legislative branch who've been clamoring for a session to enact local relief efforts as soon as possible. I know you asked them earlier this week to delay to avoid duplicating the federal efforts, but with those federal programs not kicking in for 2 weeks or even a month, has there been any discussion in the executive branch to reconsider that and launch some sort of local relief funding for those in need?
Okay, so, Kevin, like as we speak, the federal government is also trying to get all their details out. And there's a great pressure from the National Governors Association to make those relief benefits sooner. For example, you heard Secretary, I think it was the Labor, Scalia, talking about, it was the Secretary Mnuchin talking about the PPP, where they are going to give those relief like tomorrow or in a few days. Also with the small business reliefs, those are coming soon. I know that Secretary Scalia, also from the Department of Labor, is working really hard to get those relief going. The issue here is that I don't want to mix up what local and federal are doing. I want to make sure that we all have a clear understanding of what all these relief programs are and what all these benefits are, and how that would impact in terms of our local general fund or not. And like I said, immediate relief is here. We have public assistance and we have the food stamps. I'm informed that food stamps alone has already increased their applications and their approvals by about 272 more people. And they do it within a day. So we already have local programs, Kevin, that is immediate right now. It doesn't require legislation. They are ongoing programs that would get relief to our people. There's already relief from the GPA and the GWA saying that they can work some payment plans. Nobody's going to be cut off with their utilities. No one's going to be evicted, and so forth. So I think there is great relief programs, and I am very appreciative of what the senators are trying to do to provide more benefits and opportunities for our people for greater, so that they can buy their food and so forth. But I just want to make sure that we are all together on this. And so I'm having my advisors, Ricky and other people that would be giving a presentation to the senators, because there's also a lot of misinformation I think that the senators are getting from other people. Like, for example, is the $112 million care relief for states, do they have to be legislated by the legislature? It does not. It is a direct benefit subsidy to our people through the governor's offices. And this is a win for the National Governors Association, because that was what they were lobbying with, and the House of Representatives put it in. So there's lots of misinformation out there. So I'm having Ricky, who has been tracking this, he's been really good, and other other government agencies that have been talking to their federal counterparts, like Dave De La Sola, Tess Archangel, Daphne Shimizu for the DRT and through Treasury. So I just want us first to get all the information together and come up with something. If the senators feel that there's more that needs to be done, then let's come up with something after we realize what are all the federal help is going to be. That's my only reason I asked them to kind of hold off on that, so we can have better information and make better decisions.
Thank you, Kevin. Pacific Island Times, Johanna.
Half a day, Governor, can you hear me?
Yes, Johanna.
Hi, so my question is about the issue of limiting travel on the road. So how will there be a curfew now?
There is already a curfew for the minors, but I am not imposing a curfew for the adults.
Okay. And will this like affect the Grubhub or other food industries? I know you said that we'll be able to get food, but like also like how will it affect like also like people going out to work out, like people also like going on their daily walk?
If that's on the executive, if that's an order in the executive order that says you can, then you still can. So yes, if you all the beaches, all the parks are closed, but if you walk through a park, that's still okay. But you can't come with your barbecue and all of that till you know how we are, right? Oh, let's go. It's only going to be our family, and by the time our family gets there, there's all other families are there. So that's why I closed the park and the beaches. But if you walk around the park, and I'll tell you, I've been walking, and people are adhering to the 6 feet distance. They are, and they're wearing masks too. So the advice from the medical profession is with this virus, you need to have good nutrition. You have to have good exercise. You need to go out and in the sun. So take your kids outside the yard, play baseball, basketball, stay outside, and that's okay because it's within your family. But you cannot invite the whole neighborhood kids to the basketball or the baseball game.
Okay, thank you, Governor.
All right.
Pacific Daily News, Steve Lampiaco.
Yes, hi, Governor.
Hi, Steve.
Hi. So since the doctor's projections go out 5 months, does that mean that these new restrictions will be in place for at least the next 5 months? And what other steps are you prepared to take if they're ineffective?
So the restrictions are stayed in place as long as we can see what the results are. So if we are moving along and the measures are done, you guys stay home, you guys, wash your hands. Best if you also wear a mask in public. You don't congregate in the grocery store, abide by the requirements of the grocery store. If we do all of that, and we're seeing that the cases are going down, right? Or they're not as frequent, and we're seeing that there's not that many hospital, hospital admissions, people aren't on the ventilator. So the guidelines with CDC is that if the last death has to be 10 days out. So like if you have a death tomorrow and you don't have any deaths for 10 days, that's a good sign, and maybe you can start lifting up some of those restrictions. And also the hospital, if the hospital is starting to have normal kinds of activities, then that's a good thing to do too. And so that's why I'm pleading with all of you guys. If we all get together, do what we're supposed to do, maybe we can finish it in 2 weeks, in 3 weeks, in 4 weeks, and not have to, go out the 5 months that the trajectory is saying. It's really up to us. We control it.
And I guess the second part to that question was, what other steps are you prepared to take?
I can't, I think we've taken a lot of steps already. Roadway restriction. I guess the worst would be close all businesses, close the military base down, no civilians over to the military base, no construction work, close the grocery stores, close the pharmacy. I mean, those are real drastic steps. And I'm hoping that we don't get to that point. And I know we won't get to that point if, again, we just follow, comply. I know it's hard. I know it's already been 3 weeks. But I'll tell you, if we won't do this, it will probably be 5 months.
Next we have Patty Arroyo.
Good afternoon, Governor.
Hi, Patty.
Hi, Governor. You were just granted authority for Title 32, and that suggests that there is an opportunity for you to activate the National Guard for additional security. What does that entail? And on that point about engaging the National Guard, seems to suggest that if you engage the National Guard, you are wanting to engage them into a further participation into enforcement in the community.
So Patty, your last part is didn't really come in.
Talking about martial law.
We don't have a really good connection. Can I just answer what I understand the question to be? So with Title 32, what that did is it allowed me to deploy the National Guard, and the funding for that deployment would be from the federal government. I will just tell you that I have already deployed some of our National Guards in the last 2 weeks, as were helping us to provide security to our quarantine places. And also my state surgeon was also inactivated. He is now the National Guard state surgeon for my operations. And then some of his people, Dr. Louis Cruz. Are you Colonel?
Major.
Oh, Major, sorry. Major Louis Cruz.
Take the promotion.
And of course, our Colonel and former Lieutenant Governor Mike Cruz. These are the guys that I have. Oh, and Dr. Cruz just informed me that we also are bringing in combat medics. We have also activated some engineers that has helped us with the assessments of some of the places. So I activated nurses already that is also organizing. So we are already activating. What Title 32 just says now is that these federal, the expenses will now be under the federal government. Plus, I am able to use also military assets.
Patty, any follow-ups?
I'm sorry, Governor, can you hear me now?
Yes, but you know, you were like in slow motion, very slow, that I just didn't understand your question.
Sorry, I've been up since 3:45, ma'am. I think that the question was the community is worried about there being declared some sort of martial law, which means they can't get groceries. How can you assure the public about pharmacies, about essential services that they'll still have access to?
Yes, you know, I think declaring martial law is not the right way to go, because I do understand people still have to eat. People still have to get groceries. They still have to do their pharmacy. They still have to go to their medical clinics. You know, there has to be some movement in order for you to continue on with your daily, however normal it can be in this situation. So having the National Guard there doesn't mean that. It just means, thank you, National Guard. You're helping us to try and enforce our restricted travels in the roadways, because you are still able to do those things. We just want to make sure that we can minimize as much the travel and the contact out there in the community.
Okay, everyone gets one more question. Nick Delgado. Nick?
Sorry, hear me now? Governor, hi.
Yes.
So just a follow-up question to some of the list of things that you'll be implementing. Does this mean for Guam then that there's a lockdown of sorts, or a partial lockdown? And then what does this mean for the school systems and the other agencies that were to remain closed through the 13th? And then if I could ask also for Admiral Benoni, were there any issues during the initial transfer of the first group of sailors, and how are those sailors responding to their captain being relieved of duty?
What this means is just an escalation of the stay-at-home measures. It doesn't mean lockdown. It doesn't mean martial law. It just means I am using my authority to make sure that we minimize exposure of our community, so that we can better control and eradicate the transmission of coronavirus. So the measures continue as they have been. I am now just making sure and enforcing that you're doing what you are supposed to be doing. So, Admiral?
So I can answer the first part of your question. I'm not going to talk about the second part of your question because I have no knowledge of that. But the first part of your question was, were there any issues during the transportation last night? And with the logistics operation, there's always some small friction points, but there were no major showstoppers. There were no issues with respect to contact like we had all worried about. We had the proper people in place to ensure that the quarantine is going to be enforced. And from what I understand, my first reports today is that all the sailors are complying, and the deliveries of health services and food services went very well.
Thank you, Nick. Wayne Chargaloff.
Hello. I actually have a question, another question for the Admiral.
Oh,
Go ahead, please.
Hello, Admiral. For the sailors that are in quarantine in the hotels, what would happen to them if they do test positive during their daily checks? Like, what's the procedure for that?
So regardless of whether it's a positive test during their daily checks, if anybody shows any sort of influenza-like symptoms or any health degradation while in quarantine, we'll follow the same protocols that the government of Guam is doing with their quarantine hotels. That individual will be pulled out of the hotel, obviously in PPE, personal protective equipment. They'll be transported to Naval Hospital where they will get evaluated. They will get a COVID-19 test in some manner, whether that's whether we have the capacity to do that here or we have to send it off island. And then they will be transported by military transportation back to Naval Base Guam where they'll go back into isolation. Does that answer your question?
Yes, it does. And has the Navy been able to keep their families updated as far as what their situation is?
So I do understand that the majority of the sailors have access to Wi-Fi and internet, whether it's off the ship, on the pier, within their quarantine areas or isolation areas. Whether or not they're calling home to their parents, that's not my role, or I can't enforce that, but I would strongly encourage people to call mom.
Thank you, Wayne. Nessa Laconto.
Thanks, Crystal. So I guess everybody wants to get back to a normal life, whatever normal is going to look like after this is all over. And I'm wondering if there's anything that we can proactively do in the way of testing, because it seems to me that testing has been very successful in other countries such as South Korea. And I want to hold it as an example, what the military is doing with the Theodore Roosevelt. They're doing quarantine, isolation, and testing, because they want to get that ship back out into the ocean as fast as possible where it should be. Is there anything that we can do testing-wise, and can you give us an update on where we are in testing? And then I wanted to ask the Admiral if also, if he could just give us an overview of what they've been doing to get the Theodore Roosevelt back into the ocean, and what the military can do to help us with testing if we need that help.
yes, thanks, Nestor. Yes, of course, testing is very important. And as you know, we have limited testing. And what we are doing is we are prioritizing individuals so that we can appropriately and adequately use our testing. If I had it my way, I would love to test everyone, but that's not the case, and that's not the reality. Other countries are not testing everyone either. I know the US also is prioritizing their testing, and so we did have a priority list of those that should be tested, and of course it's those that present themselves in the emergency room, those that have comorbidities, our healthcare workers, and also our UMCO. And so as far as testing capacity, we do have tests that is available to test those priorities right now. I am also working very closely with CDC to get more through FEMA, through HHS, and of course, DOD is helping us also in trying to get the tests here in Guam. So right now, Nestor, I cannot test everybody. And I do know the importance of testing, but I also want to say that whether you are positive or negative or you're not tested, assume you're infected so that you can continue on with the measures. The measures are the same whether you're a positive or a negative. If you're asymptomatic positive, you don't know that, but you act like we're all infected, and that's the attitude that we should start using in order for us to really be committed to complying to the measures that we have asked you to do. So this actions that we are doing is very much similar to what other countries are doing, and even Singapore. Singapore has been very good in keeping their cases down, and the U.S. is just ramping up its actions and measures also. So I'm hopeful that in the next 2 weeks we'll have some, better results. Anyway, I'll have to add more. I think he asked you a question.
I'm not sure.
What was your question, Nestor?
Admiral Minoni, as you know, the Chief of Naval Operations says you guys are accelerating your testing. I think he said the last press conference that I listened to, you guys are up to 500 a day or so. Can you just explain to us what the military is doing in terms of testing, quarantine, and isolation, and what your program has been to get the Teddy Roosevelt back out into sea?
So with regards to testing, we are ramping up our testing capacity on that ship and across DOD to not only support TR, but to support the greater military need, as well as any mutual aid agreements we have here on Guam and the CNMI. We're doing things like flying military tests to other countries that may have excess capacity. As you know, we fly all our tests from Naval Hospital or courier them back to San Diego. We're working to increase capacity on the ship, but like the entire United States, and we're seeing across the globe, everybody's clamoring for test kits, testing capacity, and increased capability. We're just one of those groups that are clamoring for it, and that's causing some issues in terms of how much we can do a day. Obviously, we would like to test all the sailors as fast as we could. We just have some logistical challenges that we all have to work through. I will tell you, though, that the lessons that we're learning with Theodore Roosevelt from a logistics perspective, and then some of the diagnostics things that the medical folks are doing, we're certainly sharing with Government of Guam through our PHEO and DPHSS collaboration. And then those logistics lessons that we're learning will certainly be applied to support Guam and the CNMI moving forward.
Thank you, Admiral. Thank you, Governor.
Thank you, Nestor.
Kevin Kerrigan, you get one more question.
Yes, again, to Dr. Cabrera, I'm sorry to have to go back to the death figures again, but information we've received,
Sure.
Dr. Cabrera, that you gave a presentation to the legislature yesterday and predicted 2,941 deaths from coronavirus on Guam and over 6,000 hospitalizations by June 7th under the current measures. And if we adopt these new restrictions that the governor is proposing, that might be reduced to only 740 deaths, although by September. Is that accurate?
So let me put up my screen again here.
But is that accurate? Is that what you told the legislature yesterday?
So I did not have a formal briefing with the legislature, just to make that clear. There was some informal discussions overall. But what you're seeing here on the screen again was the summary, where this is a simplified manner here, and you can actually see that the numbers you're stating is very similar to what you're seeing in terms of, like, for example, the green, a 50% decrease that we could see a total death after about 5 months down to 700 or so. These were rounded off just for simplicity's sake, but as you can see here toward the July marker is where you would see, again, that's total, but then what you're seeing in the peak here is more about the timing of that peak. Does that help answer your question, Kevin?
So 2,941 by June 7th is an accurate projection unless something changes. Is that correct?
No, so just to be clear, so if you just reference this slide, because what you see, the media will get the copy of these slides here, which is the official slide. So anything that's been in circulation is completely unofficial. I want to make that very clear. And so, but what you're seeing here is what we're quoting here. If you read word for word, hospital beds needed at peak is 6,000, which will occur around this point here, which is the first week of June. But total deaths after 5 months will be about 3,000. So that's the 2,900 or so number that you're saying, but it was rounded up to 3,000 here. Is that clear?
That's clear. Thank you.
Okay. What the point I just wanted to make to go ahead and just show here is that when we are looking at this, at the death rates, I wanted to make this one point here clear because I think it's important to show this. Pardon me, but it's okay. Well, the main point here is that in every single country and in every single state, none of their death rates have completely plateaued. And I'm speaking about South Korea, China, even Singapore. They're plateauing, but they have not plateaued. And so we have to be very careful when we talk about all the very strict measures that these countries have done to really enact, major efforts to slow down and really flatten the curve, so to speak. But they're not completely out of the woods. And so we have to be extremely aggressive on our side to try and match their trajectory overall. And it's been asked of me several times about whether, how far away are we from let's say New York's surge or Italy's surge. And I think, if we don't change what we're doing right now, we will be Italy in about anywhere between 3 to 6 weeks. And that's a very tough thing for me to say and a very tough thing for me to swallow. But we have the opportunity to look at these cities in Milan and New York City, which have some of the world's greatest healthcare systems, starting to collapse. And we have the ability to look at them like crystal balls and start learning now and what to do to help them. One of my really good friends from residency is a chief quality officer at NYU Hospital Systems. He's reached out all the way here to Guam even to find out ways that we can help them in terms of they have patients that are dying without any palliative care. They're looking at different efforts for palliative measures that all his contacts throughout the country, they're begging for help. And so we're trying to do everything we can. And in that process in helping them, we may be able to learn more for us in terms of what we could expect. Sorry, a little bit of a runoff there, but I wanted to make sure those points are very clear.
Appreciate it. Thank you, Dr. Guerrero.
Thank you, Kevin. Johanna.
Hi, so my question again is for Dr. Cabrera. So I'm asking, will your team release the complete data and methodologies used in this current model so the public has the transparency from government given the unprecedented restrictions on basic civil liberties?
Oh, absolutely. And so, that's no problem at all. These slides here are for more simplistic sake and our best efforts for public consumption. But our methodologies are completely open. And in fact, we encourage peer review. I want to be very clear also that we've actually very proactively sought out peer review in terms of having independent physicians and review our models here on island, and then also getting input from the local CDC representatives here in terms of helping us shape the model that we're using. And what was our greatest corroboration of the model was that the U.S. Army Corps of Engineers and the U.S. Army itself actually created their own independent study that we didn't even know that they were doing. And we were able to see that, and in their worst case scenarios, it actually looked a little bit worse than ours, actually, in all honesty. But their methodologies and the estimations, which were educated assumptions made, were they lined up fairly well with ours, and in the end, we're showing pretty much the same scale of what we were up against.
Thank you, Johanna. Steve Lampiaco.
Yes, I also have a question for Dr. Cabrera about the projections. So I noticed that the best case scenario reflects a 50% decrease in spread. It's not 75%, not 90%. So does that suggest the advisors believe the spread likely can't be cut by more than 50%, and that 700 deaths is the most likely outcome by the end of summer?
No, Steve, yeah, that's a very good question, Steve, and I want to be very clear about that. This was just put here so that we can understand a reference of what these numbers would look like. So if we were trying to use the percentage decrease as a scoreboard, so to speak, if we were down to 40, this is what it would look like. If it was down to 50, this is what it looked like. In the rest of our models, we go down further. And just for example, at least the numbers that were reported out of China in Wuhan, they were able to get down to 80%. And so that was with their efforts overall. Can we match 80%? Who knows? And I think that it remains to be seen based on what we can do in terms of our ingenuity and our commitment to the recommendations, that maybe that's actually possible. And if my prayers are answered and all of Guam's prayers are answered, then what we'll end up seeing is just the equivalent of a really bad flu season. But it's going to take a major, major, major commitment on all of Guam for that to become true.
Thank you, Steve. Patty Arroyo.
Yeah, for Governor Leon Guerrero, are there consequences to people who are being stopped by law enforcement for maybe deemed unnecessary travel? What are the logistics of how people move about?
Right. So as I had said earlier, that you know, we are working out the details of all of that. We will hopefully get those details by Sunday, and we will be, of course, announcing it to the people. But right now, we are in discussions of what consequences would there be for not adhering to the measures. But I don't have any definitive information right now, other than we are discussing it and we are working out the details.
Thank you, everyone. Governor, closing remarks.
Yes, I just wanted to thank Admiral Manoni and my physician advisory group that have come here, and of course our public health stakeholder that have come here to provide information, and most importantly to share what the trajectory and the predictions are in if we didn't do measures, if we did measures, if we complied to the measures, and just thank them for their work and their information. And we need to take all of this to heart. Added restrictions and added measures are just that. They are added to what we are already doing. The key here is complying to these measures. I want us all to comply to these measures so that we do have 80% by 2 weeks, 3 weeks, 4 weeks from now. That's the goal. So the more we are compliant, the more that we stay home, the more that we do measures to prevent transmission, the more that we protect Arm and Umku, the more that we make sure that we're not traveling if we don't have to travel out there. All these are very simple measures. They don't cost anything. They don't require anything. The only requirement is commitment, persistence, vigilance, and compliance. And I know that we are a community that have gone through major disasters. We are a community that we know what to do to beat the disasters. And this is one disaster that definitely we have to beat, and I'd like to beat it as soon as we can. So please, media, you've done a really good job out there trying to educate the community. I like the creativity of the media in making out and sending out the messages. Let's continue that, and let's be more forceful, because it's for the love of our community, the love of ourselves, our children, our family, and so forth. So we want Guam to be back to normal, as like I think someone said, as whatever normal will be after this. But that's our goal. Our goal is to eradicate this virus and to move on with our normal daily life. So thank you again, and thank you for your cooperation, and thank you for your support. And stay home.